Hello and good evening, good afternoon, good morning, wherever you are in the world. I'm Dr. Philip McMillan, and I have again with me one of my favorite guests. And starting from April 2021, I had my first, was it April or was it? Yes, April 2021. I had my first discussion with Dr. Shankara Shetty. I was blown away at that time. And I can just tell you there's a reason why I said Dr. Shetty is a COVID hero, and I'll be explaining it as we go through. It's not just about what he understands, but about what he was willing to do. I was thinking about it beforehand, and I asked myself, do I know of any other physician, any other doctor who at the beginning of the pandemic, instead of staying home and staying behind their protection, actually called patients in to see and understand the disease? I mean, I'm telling you, that is absolutely phenomenal. He risked his life to do that. My goodness. So, with great pleasure, I have with me Dr. Shankara Shetty. So, Shankara, for those people who don't quite know you, could you just do a quick introduction and then we'll take you through some of the other things?
Okay, my name is Dr. Shankara Shetty. I'm a natural science biologist and a general medical practitioner. I have a private practice in Port Edward, South Africa, and my practice serves a broad diversity of clientele, both in race, ethnicity, and in socioeconomic group. And I've been a frontline COVID doctor. I endeavored at the start of the pandemic to see patients and get an understanding of the pathophysiology around the disease so that it would inform my treatment choices and would inform further research or the direction of further research to aid in our understanding of what was going on.
Excellent, Shankara. And just to make it clear to people, as I said at the beginning of the pandemic, you took yourself out of your house, the comfort of your house with your family, put yourself alone because you didn't know what you were going to be facing, and you went to call patients in to try and understand the disease. And not only, you weren't just calling patients who were sick, the minute they had symptoms, you wanted to see them. Why did you do that?
Philip, I think a few reasons. One, the population I serve was very anxious about what was being put out. Doctors were being discouraged from treating patients, and they were anxious about that. So, to allay fear, I made it clear to them that I'll be available to them. That was one major issue to take away the fear surrounding it, that they knew they had someone that was willing to stand up for them. And I think the second thing was to understand the pathology. Now, to understand the pathology, viral illnesses tend to follow a pattern in the way that they infect us. So the first day you get a viral infection is not the same as the last day, and so the treatment's not the same. But the way that that illness evolves is vitally important in dictating the way we actually intervene with treatment. So I needed to see this first up for myself and to understand how the evolution of the illness progressed. The initial patients that I saw, Philip, had absolutely no breathlessness. So that was the one symptom that seemed to be getting people onto ventilators and causing all the mortality. And I needed to understand what was triggering that symptom. So I had to endeavor to examine the patients to see what was going on.
And one important thing about this, because when you looked at it, and just to clarify, your thought was it was more like a hypersensitivity response to the virus. Now, both you and I have different thoughts on it because I think it's more of an autoimmune response, but both are very similar in the sense that they trigger the immune system to overreact. Now, it meant that very early on, you started to use proper doses of steroids. About when did you start that in the pandemic?
Philip, it was towards the end of March when we saw our first cases. Look, I had an understanding that we were dealing with a transmissible pathogen that had an insert in it, so likely had been tampered with. and would present with a novel pathology. And so I needed to see what that novel pathology was. Now, steroids, we knew that steroids were beneficial at the start of the pandemic, but steroids have they're a sword that can cut both ways. If you give it too early, you'll suppress the body's natural immune response to an infection, and that will allow the infection to run unchallenged. But at a certain point where there is a reaction without an infection, an inappropriate reaction, then you could use a steroid to stop it. Now, so the point at which you intervene with steroids becomes vitally important to get a benefit from it. Too early, and you would negate the benefits, actually cause more harm. So I asked patients to come back when they got breathless, if they did. And strangely, everyone that came back exactly a week after the onset of the illness. I took time to time the first day, and everyone came back a week later, all those that had the reaction. And the reaction was very sudden in onset. The day before, all these patients were fine. They thought they had recovered. The reaction was very quick in onset and very aggressive and caused a very rapid decompensation. So, looking back at your understanding of pathology, there are very few pathologies that would cause such a sudden decompensation. One of them is a severe allergic reaction to something you're highly allergic to. And if untreated, that would lead to your demise very quickly. And the second is an exposure to a venom, which would lead to your demise very quickly. And both require a quick, aggressive treatment. So the speed needed to be addressed by educating patients on the eighth day so that they would be aware of when the start of the reaction would occur and present to me timeously.
And one important point, it's interesting. And one of the lessons that I have learned through the pandemic is I no longer look at status, meaning that the top professor at wherever is not necessarily the expert if he doesn't get the outcomes. So, outcome based science is what I believe in. And so when I see outcomes like what you are doing, I don't care what anybody else says. I go back to the research to understand why it works. Not if it works, but why does it work? Now, if you think about it, you started with steroids in about April 2020. The recovery trial from Oxford was June 2020. And the whole world followed them because it was Oxford. They wouldn't have listened to you.
Philip,
How? Mhm.
look, a lot of I think my understanding of the medication comes from my understanding of the clinical picture that the patient presented with. There's a lot of medication that I mentioned in the article that I published early on in the pandemic, from the antihistamines to montelukast to doxycycline, hydroxychloroquine, ivermectin, all these drugs that would have had benefit in the pandemic, and it was because of clinical improvement that I mentioned the efficacy. Now, every one of those drugs that I mentioned has been proven to be effective in COVID, effective in treating coronavirus. So I think, we the egos have come into play, and that's a big part of the problem we have in the pandemic.
And
And
when we,
when you say, Philip, outcome based an outcome based approach to this, uh, that's exactly what I did. Speed to recovery means everything. It's a patient in front of me, and when he recovers, he's usually very thankful. So that's my
yes,
aim: to get him to recover as
absolutely.
quickly as he can. So
So,
I found when I put patients on steroids, I timed the speed to recovery. When I added a specific drug dependent on my understanding, I looked to see if it influenced that time to recovery. And if it did, then it was doing something. And then it fortified and made me go back and redirect and relook and refine what I was doing.
yeah, I tell you, when I think about it clinically, I think to myself, suppose I started to hear a cohort of patients. Not that it does. I'm just picking a random medication here. So something like, say, Panadol or acetaminophen. Suppose I started to hear a lot of patients who had end stage heart failure were finding that when they took this, they were getting better. Would I tell them that they were wrong? or would I go to understand how in the world could this actually be getting them benefit? This is what I mean in terms of outcomes, even though it may not make logical sense to me. At the end of the day, if a patient is getting better, that is the outcome. That is the whole purpose of what you do. And you then understand it afterwards. You don't say, this can't work because it didn't fit within my paradigm. How do we get out of that kind of practice of medicine?
I think it's. I think we need to realize our ineptitude at understanding everything around us. Philip, when you do something that makes a difference, it is your obligation to go and find understanding in why that happened. We don't know everything around us. So I think a healthy, innocent curiosity is vitally important. And the people that refuse to look or are not so curious are not that innocent. So I think, yeah, I'm a child. Like I always said, Philip, I'm a child with a toy. I don't blame anyone for what's happened, but I want to figure out how this toy works. And that
Yeah,
innocent
that's
child shows up everything.
that's right. It's just a curiosity, and it's that curiosity that helps us to be able to make breakthroughs in what we do. Now, you have come now under attention. Now, just to keep things in context for the listeners, over the past almost 3.5, almost 4 years, you have seen in semi rural South Africa, without access to a major hospital 45 minutes away, you have been able to save every one of your COVID patients. You've had zero deaths. Now, a lot of people still don't believe it. They say, no, it's impossible. He's making that up. What do you say?
I think Philip, they've seen the deaths around them, they've seen what's happened around the world, and what I've done seems impossible. But it's a very simple perspective that I have. This is not rocket science. We've all treated bee stings and anaphylactic reactions before, so I don't think the medical profession needs to be completely retrained. And I think the simplicity of what I achieved makes it unbelievable. In all the controversy we've seen, in all the mixed messages we've seen, in all the illogic that we've seen, something that simple looks almost unfathomable.
Is it that the medical community could be feeling embarrassed that, listen, technically, one guy in South Africa figured out that two simple, off the shelf drugs, steroids, and at the combination at the right time could have caused almost a fraction of the deaths. I'm not going to say zero, but a fraction of the deaths across the world. Imagine what the public would think. Is that
Yeah,
why?
I think, Philip, we need to ask these questions. There's absolutely no way we're going to get to a brighter future without examining what we've done in the past. And when you talk of the results that I've achieved, Philip, I mean, I've helped a country, in North India. We managed to bring the death rate down from 5.9 in the first wave without treatment or with the authorized treatment. I trained all the specialists in that country to treat COVID. And a month later, they called me in to educate the rural doctors. And we brought the death rate down from 5.9 to 2.1 almost overnight with instituting a plan for early treatment, which included educating the population about the eighth day so they could seek appropriate treatment, putting out a publication so that they were aware of how to document their illness. And of course, we've got the data. I'm just waiting to get it all together to publish it. Now, if we could make a difference with early treatment on a nationwide basis, I can't see why this needed to be what it was. I say it and I'll say it again. No one needed to die from COVID. Yes, we have people that are comorbid, that have a high risk of fatality from minor illness, but all the healthy people in the world that passed away, that should never have happened. And if we instituted early effective treatment and saw the benefits of it, there would have been no need for any other intervention. And any other intervention, if we had an effective means of treating the pandemic, would only have added a small percentile of benefit to what we would have already achieved with early treatment.
Shankara, this raises the question, and this is part of the reason why I think I'm highlighting this background, because That work, I'm telling you now, you may not realize this, but when we look back in 40 or 50 years, I guarantee you that anybody looking historically at that time will say, oh my God, that was genius. That was an absolute tremendous outcome from a pandemic. So it is going to be recognized eventually. But to think that at this time, after doing that kind of work, you are then challenged to be have your license taken away. What are they thinking? I mean, really, seriously, what are they saying? What did you do wrong?
Well, I'm trying to figure that one out, Philip. I think it's got to do with egos and an agenda. So yeah, they must bring it on. Uh, a lot of it is about not following what was set out. I guess when you're at the front shining a light, you can't be following, and they should have taken the time to actually follow me. So I might not have followed the prescripts, but the prescripts were, to me, out of a thumbsuck. They didn't have any information or studies around their suggestions to justify it. And I'm not one to believe everything I'm told unless I see it for myself. So I took the opportunities throughout the pandemic to clarify every bit of information that I got, to see it with my own eyes and to see the patient recover in front of me or not. And that would define my or direct my judgments,
And so let
not
me
any
just put
paper published by any journal.
yeah, so let me just put it into context. What they are saying is that you who risked your life at the beginning of the pandemic, something they did not do. Let me just make it clear to anybody listening. They did not do what he did. They did not go and look at the patients who had COVID at the beginning on their own without knowing what the outcomes would be. So you did that. You see a pattern. You then institute a treatment and get results before anybody else. And they are saying to you, you should have then stopped what you were doing to do something else that didn't get results because that's what we say you should do. Now, how does that make any sense?
Philip, it's even more it's even more overt than that. Just to put context, Philip, in the first wave, uh, let's take a patient that comes in critically ill. Consider a patient with no comorbidities but with a saturation of 60%. Now, I've seen patients with saturations of 50% on oxygen, and I've managed to turn that around. But take a patient with a 60% saturation. If he went to hospital, he was duly sedated, put onto ventilation. Remdesivir was tried on him. And we know the amount of death from the ventilations. I think it's 7 or 8 out of 10 patients on the ventilator didn't survive. Now, so you're taking a patient with a 60% saturation, sticking him in hospital on a ventilator for almost a month. He demises, and he, of course, left with a huge medical bill. Now, that very same patient, when he walked into my practice on the eighth day with the 60% saturation, I would duly treat him and, of course, call him first thing in the morning to make sure that I was aggressive enough to have turned his reaction around. And I'd say in a majority of cases, when I'd make that call in the morning, the patient was completely recovered. I mean, I had to call patients to the telephone because they were busy washing the car, even though they had a 60% SATs the day before. So when you talk of speed to recovery and the improvement that you see, I could not avoid the improvements that I was seeing. I could not stop doing that. That would be a harmful thing to my patients. And when I saw those miraculous recoveries, I understood the pathophysiology, and it was my aim to educate the world, not to do a randomized double-blind clinical trial to educate those who are supposedly educated. That wasn't my aim. I didn't need some expert vetting what I had said, and he hasn't seen a COVID patient. People were dying around the world, and it was my aim to spread that knowledge. And so I took the step to do interviews around the world to educate people about the eighth day and to train doctors globally into as to how to treat this pandemic. And mind you, Philip, all the doctors that I've treated had the same outcomes. None of them have had deaths on their hands.
This is really important, and I'm I'm a clinician as well, and I believe in the science, in the research, and the growth of medicine over many, many decades. But this, as I said, is absolutely embarrassing. It is embarrassing that the medical fraternity, instead of trying to understand outcomes, would try and block it effectively. I just can't grasp that. I can't understand why we wouldn't, no matter what, be always looking to find ways to make patients better. It almost seems as though they do you think they would have rather patients to die following their protocol than using what you had, which you knew was saving life? I can't believe
Uh,
that.
yeah, Philip. Look, I was called upon to address many different sectors of society that were dealing with this pandemic, from the politicians that were involved, our ministerial committee on COVID, but I refused simply because they weren't going to make the difference. It was the doctors that were going to make the difference. It was the patients that were going to make the difference. The regulators seemed to have an agenda with this. And of course, trying to enlighten someone can only occur if they wish to be enlightened. So if your ignorance has an agenda, there's no point me trying to enlighten you. And so I refused to go down that road of looking at the politics and the people in control of the pandemic. To put perspective as well, in this country I speak of, I was invited to train the specialists. A month later, I was called back to train the rural doctors. Now, this is a country that does things pragmatically. And in that second meeting, Philip, the ICU specialist that I had trained a month before insisted that he starts the meeting. And what he told me was that he said, look, you've trained us a month before in how to treat COVID. He instituted all my treatment protocols in his ICU. And in that month, they had no ventilations and no deaths. And he narrated a story about his grandmom that came in with a 70% saturation. And it was 5 days in hospital when we had this meeting. And she was saturating at 100%. Her bloods were almost normal. They were waiting for her last results to send her home. And as a country, they decided that if they were getting these remarkable recoveries in ICUs, then patients didn't need to be in hospital in the first place. And so they invited me back to train rural doctors so that we could institute the treatment a lot earlier and prevent all those hospitalizations. So there's ways and means to do this pragmatically. If not, then there's some kind of unscientific agenda behind it. And I think we've seen the unscientific nature of the way public health has been handling this crisis.
When we think about it, so you were invited to another country, and your own country, instead of inviting you to hear what you have done, are persecuting you and trying to take away your medical license. Here is the question that somebody asked. I thought I should capture this here. Who has the power over the medical fraternity? I thought doctors had the authority to determine medication if their diagnosis and the processes were sound. That's a very reasonable question.
Yep.
Why is there a question?
I think Philip, the Western way of doing medicine has diverged and divorced itself from what is supposed to be a medical practitioner's job. Now, when I qualified from medical school, there was no protocols, and I qualified in the East in India. And I remember clearly my lecturer telling me, he said, "Now I've given you all the information, go make your own choices. And as long as you can justify why you do what you do in medical and scientific terms, no one can fault you." And that's the way medicine's supposed to be practiced, pragmatically looking at the patient in front of you. Unfortunately, in the West, it has become more about protocols and following regulatory authorities. Now, these regulatory authorities dictate what doctors can and can't do. Now, if I look at the pandemic itself, there were a few so called experts in South Africa telling us how we should treat patients, use remdesivir and Paxlovid and all the other things that they'd suggested. But the last time I looked, it's my name on my script pad, and I worked hard to have my name put on that script pad, and it's my choice what I write on that script pad. So all these public health officials that feel that remdesivir works, They should stand and put their money where their mouth is and write it on their script pads with their names on it, so that when any repercussions come by, they have not dodged liability. So like I said before, I don't listen to what other people tell me to do. I make sure that it's pragmatic, and if I'm confident that it's going to make a difference to the patient, then I'll do it. Otherwise, I just ignore it completely.
Absolutely, absolutely. Now, I want to touch on something here because I know you're a thinker and a philosopher as well, Shankara. When you said at the beginning, you said that you think that there was something unusual about the virus. And you mentioned that word about additions to it. Now, part of the issue that you are facing persecution on is the fact that you mentioned that you thought it could have been a bioweapon quite early on. Do you at all feel vindicated with regards to making those statements at this point?
Well, Philip, I think only time will tell. And we can see that rope growing longer and longer as time passes. If you look at what we're dealing with, let's not call it a medical intervention. Let's just call it a substance that we've injected into almost the entire planet. Now, if we want to determine the use of that substance, or the aim of that substance, then we would look at what it actually does. Now, we've seen that there's no efficacy in preventing COVID from an immunological perspective, and both from the perspective of preventing severe illness.
But
So
hold
we've
on there, Shankara. Before you go down that road, I'm talking about the virus itself. What
the,
I mean is that if, because this is what I was curious about, what made you think so early on? Because you said it right at the beginning. What made you think so early on that this was not just from a wet market?
Philip, I think we went down the wrong road looking at science to tell us that. I think sometimes you need to look at the response, the social response to things, to understand what really transpired. If my wallet goes missing from my desk and I find it in your hand, then I got to look at the response. And if you say, well, it looks a lot like my wallet, I'm mistaken, and then, well, it was a mistake. But if I draw your attention to my wallet in your hand and you run for your life, then you probably stole it. So, all manner of looking at the spot where the wallet's missing from is not going to give me that information. So, I think we need to look at the response to the pandemic and the response to what I've done and achieved that will dictate my understanding of what the agenda is. Now, to bring some understanding to my experience, I knew that there was an insert in the virus from the genome released from the Wuhan, from China itself, and that told me that this was a lab engineered virus. It had some lab signature on it. It was not natural. I needed to look at the illness to understand the pathology that it would cause. Seeing that hypersensitivity seemed to be the trigger on the eighth day, this insert seemed to be coding for a protein that was allergenic to some people. And of course, a bat virus took a liking to humans, and that would require a change in its receptor. And of course, spike protein was what was being coded for. And so early on, I mentioned spike protein and that it's the primary pathogen. Now, the one thing I found strange was that when someone comes out with a easy, cost-effective way to negate all the mortality and morbidity from a pandemic, you'd expect the world to stand up and listen. But I contacted all the relevant authorities and I got a cold shoulder. And of course, that was the first thing that made me realize there's an agenda. I was invited to present by the CDC twice. The first time it fizzled out. The second time, I think they realized that I was talking about spike protein as the primary pathogen, and that would influence vaccine sales and create some vaccine hesitancy. And so they didn't invite me. So I understood that there was some agenda. Uh, Going a little bit back to Wuhan itself, we had a virus, a novel virus, supposedly, that resulted in an outbreak of a strange illness in Wuhan itself. And if we look at what followed, China managed to isolate Wuhan from the rest of China. And for a very long time, nowhere else in China reported any cases of COVID. But for some strange reason, they left their international borders open and it spread to the rest of the world. And that seemed nonsensical. And it seemed that that's not the way you would have responded to a lab leak or a unusual infection. The second thing is, if it was a lab leak, you would have cordoned off that area and you would have tried to keep it as quiet as possible and tried to negate all the issues with the least amount of fuss. But if it was an intentional release and you wanted the whole world to be trapped in fear, then you'd make a mountain of a molehill. And that's what happened. They made a mountain of a molehill. So I'm of the opinion that it was an intentional release that caused the problems simply by the response I saw to it. If anyone can prove otherwise, then I think the response should have been a lot different. So I think looking at responses to things, Philip, give us a good idea as to what the original intention was.
So it raises a good question from a purely scientific, philosophical point of view. Pull us all back, the whole scientific community. If the scientific community as a whole thought to themselves, which they did actually initially until they were told not to, if the whole scientific community had said, you know what, we think that this is a leap from a lab, would it have changed the way that we approached researching and potentially treating the disease? Do you think that one step fundamentally changed the way the world approached it?
Yeah, I think it did, Philip. Nature moves in very small sequential steps. And if it was a natural virus that had evolved from a bat virus, we would have understood it a lot more easily. It would have been something we'd likely seen before, and it would have been easy to gauge to gauge treatment interventions. And it made people complacent to think that well, it's a natural virus. But if we knew it was a lab made virus, then it opens up a Pandora's box of possibilities and it puts everyone on high alert to have a look at the pathophysiology, its spread, the entirety of what this new, novel, lab made pathogen might be doing. And of course, the development of this pathogen will give us some understanding as to how to negate it. But all that was hidden from the start, and that's made a huge difference in the understanding not only of acute COVID and its treatment, but also in the understanding of long COVID, and now the understanding of spike protein production via the vaccinations.
Yeah, these are all very complex issues, and to be frank with you, when we look at where we are at the moment, I've been getting not into trouble, but some of my subscribers when I talk about the risks to the unvaccinated, and I'm saying that the unvaccinated cohort are getting complacent. They are kind of saying this is just a cold, and I'm thinking to myself, you've just made it over the first hurdle. We have another 3 or 4 hurdles to go. Please be vigilant. What do you say to people now? Because if it is a bioweapon, this is not over.
Yeah, not by a long shot, Philip. I'm seeing that in my patients. Vaxxed or unvaxxed, it's going to have consequence, repeated infection. We're not developing any robust immunity to the new variants that are coming out. So a lot of people are susceptible to getting them. And what I'm seeing is that we're still dealing with a biphasic kind of illness, but with a lot of overlap compared to the first 3 waves. Uh, what's happening is that those patients that were prone to having severe illness with the initial 3 waves tend to still have the immune dysregulation caused by the virus. So you've got the subset of people who get the virus itself and recover from it without any consequence. And then you get a subset who recover from the virus, but it tends to trigger an immune dysregulation, which results in the persistence of all their symptoms. And if that immune dysregulation is not brought under control timeously, there will be long term sequelae. And that's what we're seeing in unvaxxed patients getting repeated COVID infections and not making sure that it was completely treated. I think that is the most important thing. If you're allergic to a bee sting, you got to treat yourself every time a bee stings you. You can't treat the first sting and then become complacent about the bee. So each person needs to understand that any flu or cold they get today might be COVID. And the way I educate patients is that I make it very clear with them that I expect a daily improvement leading to a complete recovery in a reasonable space of time. So anything new or unusual or any worsening of symptoms must be reported immediately, and anything that persists, you 90% better is unacceptable. So even if you've recovered from it but feel fatigued, that's enough to have a repeat visit to the doctor to clarify that and settle it down. It's those minor symptoms that indicate a prolonged persistent immune dysregulation, which in the long run are going to have disastrous consequences. So I think even in the unvaccinated, they got to be aware. Philip, we know that the numbers of COVID were over exaggerated by a PCR test that was run with too high a cycle threshold. Today, we have an underestimation of the circulation of COVID because we stopped testing. I mean, I've had patients, Philip, that were in hospital, tested positive with COVID, and were told by doctors not to tell anyone. I guess they don't have a vaccine to to allay the fear that might cause.
I think that is a logistic problem, you know. It's a fascinating situation that we have where there's this strange thing where COVID is either serious or it's not. If it's not serious, you don't isolate patients, you don't test for it. But if you can't do it both ways, and this is catching people out. But as I said, if we have high ongoing circulation of virus, and this is where I am saying the warning to people is that listen, every time this virus breaks your mucosal defenses and causes systemic symptoms, it weakens us
Yeah.
because it is doing something there. As I said, this is not a cold virus. This is not just a cold. And I get very worried when people start saying that. And I'm thinking, no, no, no. If you go back to the origins and the roots, this thing has the capability to strip away your lymphocytes, chronic immune infection, influence bacteria in your gut. I mean, this is
Yeah.
one beast of a
Yeah.
virus that we've
And
got in front of us.
that's the reason I said what I said, Philip. Nature doesn't have the tools to design something like this. If I look
Mm.
at what I'd find as inconsistencies in the natural origins narrative, first of all, it would take many, many generations of evolution for a bat virus to infect a human host and become competent in using that host to transmit further. So, usually with these unusual infections, you get an odd person getting infected, but the virus hasn't figured out how to get the secretions or whatever that patient, whatever way it can use that patient to transmit to the next human being. So, you'd have bat to human infections, but you wouldn't have human to human infections. Here, suddenly, we have a virus that infected human beings and became one of the most contagious viruses known to man suddenly. That doesn't happen naturally. It takes a lot of mutational adaptation for that to occur and a lot of trial and error with different hosts. That was the first thing that I looked at and I thought, very strange that this would happen. The second thing that I find very strange, with any virus, we do find variants. But the variants that we've experienced mostly in the first three waves of the pandemic were variants that as well could not be justified through a natural mutational variation, simply because you had a virus in the first wave that had affinity for epithelial lining of the respiratory tract. Now, no manner of mutation would make that same virus suddenly decide it liked the gastrointestinal tract better. That's unusual, and that's what happened in the second wave. We saw a virus with an affinity for the mucosa of the gut itself. So that kind of sudden change in the kind of tissue that a pathogen finds affinity to does not occur in the normal run of the mill way that mutations occur. It's like you eat a specific kind of food, you have an affinity for that kind of food. And then suddenly one day you start eating something that is, let's call it unedible by your design. And that's the reason I feel that the virus itself has shown many traits that can't be explained through nature and normal mutational adaptation.
Yeah, these are important points. And I think some Japanese researchers actually came to the conclusion that the Omicron lineage could not have naturally evolved from the original lineage. Now, I mean, these are very, very serious allegations because
Well,
it
Philip, let me
suggests.
just put perspective. You can design a virus, and in designing that virus, you can design into it the kind of mutations you want.
Mhm.
So this doesn't have to be a new platform. It can be a platform that was designed to mutate in a very particular direction.
Listen, the implications of this are so significant. And I say to people, it's the equivalent of, and this is why I said you would make a good detective because, the wife has fallen off a cliff. The husband was there. He's getting a huge insurance payout, say, for instance. And he says, I didn't do it. Now, any detective that says, okay, that's fine, is not a good detective. You have to interrogate in detail to understand the implications and where we are now. And this is why I think that fundamentally I am very worried because here we have a situation now where the whole world is immune primed. They're either primed through infection or primed through vaccination. And now we see the beginnings of this very strange white lung syndrome. And for just to clarify to people, people are saying this is happening in China. No, it's happening across the world. It's just that it seems to be more cases in China. So it's not a virus that is spreading from China to somewhere else. It is something that is unique, that is occurring globally, similar to childhood hepatitis. Remember that? Similar to monkeypox. Remember that? We now have a white lung syndrome. And of course, it seems as though there is no way that it can be connected to the elephant in the room. Any thoughts about this white lung syndrome?
Philip, we were exposed to an allergen which caused, like you said, priming. And now, what we're going to find is when patients come into contact with a coronavirus and exposure to spike, it's going to trigger a severe hypersensitivity reaction. And what we're seeing in the X ray is not a mnemonic pattern of consolidation. What we are seeing is an organizing kind of pneumonia. And this is what we saw in throughout COVID. There was nothing new. Throughout COVID, we saw an organizing kind of pneumonia. And that is not an infective pneumonia, it is more an immune mediated process. And I think if the medical fraternity don't get up to speed quickly enough, we're going to have more deaths again from this. So, again, when this trigger happens and we see that whiting of the lung, it is a hypersensitivity reaction in the lung itself and would require the same modality of treatment that I've been uh, pushing for the last 3 years. Early, quick intervention to negate that. If we don't, we're going to end up with a lot of other immune sequelae from
And
from what, and of course the immune sequelae, Philip, with chronic exposure to spike protein is what we're seeing with the vaccines.
yeah, so this is now quite a serious situation. And this is why I am worried is that, in effect, if you have this immune priming, and as you said, nobody's really testing for COVID now. So we may be seeing exceptionally high circulation of virus throughout the communities. And my worry now is that what we are starting to see the tip of is the fact that, similar to what happened in the animal studies with SARS-CoV vaccines when they looked at it in 2012, is this hypersensitivity response unchallenged to the virus. And so we could find in 60, 70% of people, even without symptoms, subclinically, having hyper immune T helper cell responses, meaning if you did a biopsy. So even though they are asymptomatic, this is pathology that is growing. That's absolutely frightening.
And Philip, I think we have to find a way, like we did with the PCR test to find the patients with COVID. We got to find those individuals that are susceptible to this happening. And I think a simple methodology would be to develop a spike specific IgE. And you see which patients are going to have this reaction. It would be a good indication of who has developed antibody dependent issues. Simple methodologies to actually isolate those and educate those that are at risk of having these kind of reactions. And remember, these kind of reactions are going to persist for the rest of your life because you've been primed. So every time you get an infection, there's a likelihood that you're going to react immunologically inappropriately. And that needs to be quickly stemmed to prevent any long-term sequelae. So I think there are simple things that we can do, but of course, a lot of people don't want to highlight the carnage that's been caused by our previous medical interventions.
Yeah, this is part of the problem is that I don't know what the answer is because, as we know in science and in medicine, there are lots of egos. People don't like to acknowledge if they have made a mistake. And I'm really asking myself a question here that's really bugging me. Suppose the powers that be, whether or not it's in the scientific or in the government community, recognize that they had made an error and that there were ways that they could negate it, but it would be embarrassing and probably destructive to their own political opposition. Do you think that they would prefer to let people die?
Philip, the human condition is a strange one, and I think they will be to save their egos. Remember, a lot of them profited a lot from this. A lot of them are writing books about their achievements with no data to prove it. So I don't think that there's going to be a turnaround. I think this is an agenda that covers not only health but has its fingers in the socio-political environment, the economic environment of the country. If I had to clarify it in one way, Philip, we live in Luciferian times, and we need to be aware of the complete agenda that's out there. At the end of the day, we're not going to fix it. We're not going to be able to change the regulations and rewrite the rules. What we're going to have to do is sidestep it. Like in my case, with the case coming up, the bottom line is that I've shown some novel pathophysiology that this virus has brought into the picture, and that has implications for other viral illnesses in the future. The understanding of how they trigger cytokine storms and how we can negate all the mortality and morbidity. If I have a regulator that refuses to acknowledge that, wishes to censor me for what I've achieved and not look at the facts and the truth, then I think they can gladly take my name off that register because I don't want to be uh, part of their network. So I think we need to look at who the real medical fraternity actually is. I don't need a regulator that does not look at science to ratify me as a healer. If they choose to suspend me, all they do is take away the Rockefeller's toolbox of medication out my bag, and I can still heal without that in my toolbox. So yeah, they must do what they wish. They will lead to their own demise. If they wish to rebuild trust, then I think healthy understanding of the mistakes and an acknowledgement of those mistakes and a redirection is what's required. There's only two wooden boxes in this church, Philip, and one's a confessional and the other's a coffin. I guess they just have to choose which one they want to use.
Oh, you have such brilliant statements. Yeah. So Listen, I wanted to bring up one of the other things that has been in the news recently about the frame shifting. And in case anybody didn't quite understand, is what they have now found. Some people had predicted this would occur or could occur, is that specifically with one vaccine. So it's the mRNA, but only primarily with Pfizer, not with Moderna, which in itself is interesting. It has frame shifting in the modified RNA reading. So that simply means that it can lose one of the letters and then read a completely different protein. Now, I have heard scientific people say this is not a concern and that there's no evidence of disease. And I'm thinking to myself, if you're scientific, you can't say that. You have to say, we have recognized this anomaly. We didn't anticipate it. We hope there is not going to be an issue, but we will monitor this to make sure that you are safe. That's the kind of duty of candor we should have had, but instead, no, we didn't get that. Any thoughts about this?
I think, Philip, just to for the audience to understand what that actually means when we talk about a frame shift. Now, you got a instruction that tells you to make a protein. And the sense in reading that instruction results in the protein itself. So when you make sense of the instruction, then you make the appropriate protein. Now imagine you took in that sentence the first alphabet of every word and tacked it onto the last alphabet of every previous word. So you took all the first alphabets in every word and made it the last alphabet of the previous word. You would not make sense of that sentence. And you can only imagine the kind of protein that will be produced. So to say, no, 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 nothing to see here, it still makes sense. I can't see that. I think they're talking gibberish.
Absolutely. This is a significant thing, and sadly, it's the kind of thing that you will only know 5 to 10 years down the line if
Yeah.
this was relevant or not. Now, I can already predict which patients it's going to be relevant to. Now, it's not a huge percentage, but any patient that has a disease where they are already making abnormal proteins, this is going to be a problem because it's going to overwhelm their system and their body will not be able to handle it. So it will speed up disease. We just don't know who and we don't know when. So these are very, very serious issues. Now, they have also decided that they think they've found a way to fix it. Well, if it's not a problem, why do you bother to fix it? I mean, this is just, we are in some dangerous times at the moment. And I think that and this is why I enjoy speaking to you about these things. I think that these are the times when we need thinkers, people who can observe and who can think about the science and try and work it out and try and make sense of it, because a lot of this is not going to make any sense if we don't go back to the fundamentals.
Just
How
to
is the
clarify,
science?
Philip, innocent thinkers, not just thinkers.
Not just
Thinkers can
thinkers.
mislead you.
Well, thinkers who are trying to genuinely find answers.
Exactly.
So, how are we going to be able to do this, Shankar? Because as I've said, I'm smiling at the moment, but inside me, I am very anxious. I am really worried.
Philip, I think I realized in this past year that this is a lot more to do with a nefarious agenda, and I'd say it a Luciferian agenda. And I think it's our spirituality that will guide us as to where we need to go. Uh, Noah built an ark. Not everyone made that ark, and he didn't do anything to stop the flood. So I think we're going to have to come to terms with that there is a flood. And it's not our job to actually try and stop that flood. It's to lead those that are willing to the ark itself. So for those that accept that the vaccine was good for them and still want to take the injection, so be it. That's absolutely fine. But for those that seem to be awakened to the narrative that we want to put out there and get people to understand the nature of what's going on, then those are the ones I think we need to look to figure out how to change, or how to save those lives, lead them to that arc. And I think a lot of what's transpired, Philip, has brought a lot of fear to the globe. No matter what transpires, I've always believed in nature and our Creator, and I think that we will at the when all is said and done, we will still be here. Uh, all the different religions talk about the darkest hours of humanity, but that's usually followed by light. So we will, yes, as humanity, go through a very rough period. For those of us that are tasked with saving lives, yeah, we need to be at the front of it and be aware of everything around us. But I think for the rest of the people around, I think they've got to be very cautious about what they listen to and how it influences their lives. I think the biggest influence on your immunity is your levels of stress and anxiety. So I think it's time people go back to being children. We are children of God, not adults of God. And I think He wanted us to be kids till the day we die, blissful and innocently curious, and He'll direct us. And so I think all the people around us, I think that's what they need to do. Go back to being the children that God made. Not, I think the day we said we grew up, Philip, was the day that Lucifer took our hand and introduced us to all the problems of the world. And so my dad still fights with me. Wants to know when I'm going to grow up. I don't think ever. So I think, yeah, we need to go back to being innocent about it. The more, Philip, why do we talk about why the devil does what he does? He does it because he's the devil. We should accept that. I guess if all the buck came together to figure out why the lion is so violent, the lion would get bigger. But nature doesn't do that. Nature knows its place, you know? And I think for us, we need to understand as humanity our place. We were meant to live together in harmony, in collaboration, in a caring, sharing environment. So if that's not the case, then don't pander to that. Look to the future and build what you wish. And I think that's where we stand. All the regulations are only worth anything if they regulate you. If you ignore them, they can't do anything. The power is given by our collective consciousness of that power.
There's something that you said there that I think that I have to reflect on as a reassurance. And I say a reassurance, and that's about, as you said, uh, God told Noah to build an ark. He didn't tell him to stop the flood. There is going to be a flood coming. There's no
Yeah.
doubt in my mind. There's a flood coming. And I think the point that you made is to find ways for people to access that ark, to
Yeah.
find routes for them to be able to find solutions out of this. Because I tell you, I keep on saying it to people, and I don't think they quite get it. I say, if I took you back to March 2020, knowing everything you know about the pandemic, is there anything that you could have said that would have made sense to anyone? Meaning that in the context of the lockdowns and the amount of deaths and so on, I doubt if there's anything that you would say that anyone would believe. In the same way, I think we are on the brink of either a precipice or a tsunami, whichever way you want to look at it, where it's almost pointless saying what's going to happen next. Because if you say it, nobody would believe it.
Yeah.
But this is a
Look at,
flood.
yeah.
Uh-huh.
This is nature at work, right? This is nature at work. Creation and destruction go hand in hand, and we have to accept that. When a leaf falls off a tree, it makes way for new shoots. So you can't watch that leaf fall and cry about it. You got to focus on the new shoots. So what's done is done. We're not going to go back. And the more we sit and dwell on the past, we ignore a bright future. Now, everything that happened provides us as a global community the biggest opportunity we've ever had to direct our future in the way we see it and the way people want to be governed, the way people want to live, the way people want to thrive. Now, we've been regulated and governed for centuries, and it's now the best opportunity we have. When this breaks, we'll have the opportunity to build anew. But if we focus on the breaking, we're not going to plan to build anew. So I think all our focus should be on the future and how we redirect what has transpired to make sure that our children have a better understanding of what true freedom actually is and live in a society that is truly embracing of all creation.
Yeah, I think that these are important points, and as I say, I'm trying my best not to frighten people. I'm
Yeah,
trying my best to be remain objective about the science, but everything from a scientific point of view tells me that the next 2 to 5 years are likely to be horrific at a level that we can't quite imagine. Triage medicine, battlefield medicine.
yeah,
I don't want to scare people on it, but I don't think not saying it is helpful. We
yeah,
have to be honest and we have to be open. So I like what you said in that we need to focus on the future, not on the past, because the past already been done. That we cannot change what has already been done in the past. We cannot change where we are in the pandemic, but we can look to try and find answers for the future. And so, with that in mind, as we close out, Shankar, how would you reassure people who maybe are afraid, they are worried, they are anxious, they don't know what's going to happen next, they don't have control of where things are going to go? What do you say to them?
Philip, I think that's a spiritual side to things. People's fears about their lives. Uh, I think the essence. I've done a pilgrimage to Mount Kailash. I had the same concerns. Uh, to say thank you for the precious lives I've been allowed to touch over these years, but also to find guidance as to where we should go. People like us, Philip, are very embroiled in the fight, and we need to understand what the agenda is because we're tasked with finding ways to lead people to that arc, so to say. But for the rest of the humanity around, I think that the more you know, the more it harms you. And I think, yes, you want to be aware of the times we face, and you want to be aware of the agendas in place, and they solely there to enslave the future populations. And I think the way to deal with this is, like I said, to go back to being children. Philip, for 20 years, I've been teaching my patients to be who God made. There's a boy in that heart of yours that's different from everyone around you. And you can fool yourself into thinking that you're happy and secure and at peace. But if he isn't, you'll never be. So you have to be unapologetically who you are. And of course, the bliss that we need to hear our Creator and the innocent curiosity to get the knowledge of the world was given to us as children. We've forgotten. Along the way, we lost it. And I think growing up, getting taking the world's problems on has taken away that innocence and it has clouded our judgment. So I think it's for people to let the past be, to start to be unapologetically who they are, and to be playful in their demeanor so that they can see the truth for what it is. If there's one thing, Philip, that allowed me to see all the things that happened in this pandemic truthfully for what they are, is that I was innocently curious and had no agenda in this. And of course, I had full faith that if my maker wanted to show it to me, he'll protect me through my journey. And I think it is the lack of faith that's brought us to this point. And seeing that we're dealing with a crisis of biblical proportions, it is our faith that will help us heal. From a science perspective, Philip, this is a microbiologic attack. And I think that it's the microbiology of the planet that will hold the key to the solution that we need.
Excellent, excellent. This is, as usual, science, philosophy, spiritual, as usual, Shankara. Brilliant conversation. Again, and I say for all the people who have listened, this is always a pleasure to hear you speak. In time, Shankara, as I said, I'm sure about this. In time, history will show that what you did in saving those 1,400 patients in semi-rural South Africa who didn't have access to hospitals, who didn't necessarily have the greatest wealth to get all the techniques that they had, but just applying science, trusting, knowing that there would be an answer, that's going to go down in history for a long time as being a tremendous service to humanity. So thank you,
I think it was
Shankara.
my Philip. It must go down in history as my unwavering faith that allowed me to do
Excellent, excellent. So just stay with me as we do the outro. Thank you, everyone, for joining us. As usual, this has been my pleasure to listen to Shankara. I hope you have enjoyed it as well. Have a great evening.
that. Thanks, Philip.